what do I want to share with you? The topic is linking health systems to education and training. And I would like to start by sharing with you this concept of the big picture. Everything that you do, everything that we do, I always find it very important. Say, what is this all about? Why am I in this? What is my role? So what? So in order to appreciate our topic, this is what it is. You can grow up easily in a medical school, stay there as a teacher, become the top, the dean, the principal, and you may do that without fully seeing the point why on earth you are doing all those things. So I like all the time to think about the big picture. What is all this about? And then to fit the other things into it. And what is it in this case? So this is it. It is about the people. It is about the quality of life they live, their poverty, their dignity. It's about social justice. That is why you are training health workers. I hope you recognize that. And if it wasn't so visible to you, I would like to invite you to put this at the back of your mind at all times. We also live today in a connected, globalized world. And if we here in Africa were able to be good partners with our colleagues outside Africa in this globalized world, we would be able to address many of the challenges that we face here in Africa as a people. So the real point here is that nothing important ever happens until you've created the right climate of opinion. So for you, for your group, to me, the climate of opinion that you would want to be creating is one which commits you to look at your institutions as sources of poverty alleviation, improving the quality of life of the people in your countries. And we will talk about how later. So if you are able to create that climate of opinion among the academia, the trainers of health professionals, then we would be well on our way to achieving our goals. And in us Africans, it's a good time. It's a better time than before. Of course, I must be the oldest person here. I've seen a terrific Uganda, very promising, very good. My early days as a doctor, the health system here was run by Ugandans, and there were no donors. And it was running very well. But it is different now. But it is better also now. The last, I don't know, maybe, now speaking about Africa in general, last 10, 15 years, things are looking better in Africa. The economies are growing. AU is very strict now on accountability, legitimacy. If you cause a coup, you don't sit among the people. So things are better in Africa, and they are getting better. But they will get even better if you, people like you, are going to take this approach. So if there is any message I want to give, that's the most important message. That you are very privileged, like me, to be where we are. What are we doing with that privilege? So, back to health workers. This is the late J.W. Lee, the former Director General of WHO, and he made this statement almost off the cuff when we were in a high-level forum meeting in Paris, that it is about ensuring access to motivated, a skilled and a supported health worker for every person in every village, everywhere. And we have more lately added within a robust health system. But these were his words, to simplify our challenge. This is a study we did, my organization did here in Uganda. We tracked the location of doctors who qualified in 1965, 205, 206, 207. And this is where they are. They are in Kampala or here, around Kampala here, about 70% of them. It's only the other 30% who are in the rest of the country. And so, to respond to all this, these are some of the reasons. There's a huge shortage of health workers globally, and particularly in Africa. There are those equities. There are tendencies within the professions. I think, Erika, you were in that meeting, I think, one of the meetings on transformative, your meetings on transformative education. And there were these nurses who were very aggressive. I know you are a nurse. They were very aggressive. They didn't want doctors, physicians, to be called doctors so-and-so. They wanted them to be called just physicians, not doctors. So I was very struck by that. In some of the countries, there are very serious tensions between the professions. We need to mend that. We need to mend that. And changing scopes of practice, task shifting, and so on. So we need people like you to address these challenges. There are many challenges. Mismatch in competencies. The teamwork I have already referred to. In some areas, it's very strongly gender sensitive. And this also, governments, even us, health is made at home. Those of you who live in Uganda recognize that statement. And only repaired in health facilities when it has broken down. But we concentrate in hospitals, in curative. But if we spend more time on primary health care, I think we would be serving the people possibly much better. Then issues with labor markets, leadership is very important indeed. And that's why I want to congratulate your group for being here. You are exercising leadership. And I hope the leadership that you have started in this community, you are going to take it all the way down to the Ministry of Health, ministries of health, and to the lower levels of the health systems. This is a long list of the challenges that we have. Certainly, for most African countries, there has been a very poor investment in health workers and in health workforce training. Conditions are poor. People are living on wages which they can't, they are working on wages on which they can't live. The education intake in most countries does not respond to the needs. And there is still migration, and of course the populations are underserved. So I said things are getting better before. Things are actually getting better. Here is the evidence. So many years ago, you would go to a donor and talk about strengthening health workforce, and they would tell you that is very complicated, it's really for your own governments. But it's not like that anymore. Health workforce is now a major global priority. And that's a long list there of some of the steps that brought us to where we are. The bullet number 3. I attended a series of meetings at the World Health Assembly where African ministers really showed leadership. They were very angry because at that time there were people coming into hotels in their countries to recruit nurses, doctors, and take them away. And they caused, without those resolutions being on the normal agenda of WHA, World Health Assembly, they had 3 resolutions, 1 year after another. And that is really what shook up everyone. And we ended up with the Joint Learning Initiative, the High-Level Forum on Health Workforce, the Global Workforce Alliance was created, the World Health Report on Human Resources for Health, and now, you know, we are on. The health workforce agenda is on as a global priority. The health workforce crisis is identified as one. We have a code on international migration of health workers. And, you know, we are on. Things are much better than they were like 10, 15 years ago. Africans also are moving on health, including health workforce. You may not be aware, African heads of state have met. They were Abuja meetings. They started with malaria, 99. Then they went to HIV, TB, and so on, 2001. They were in Kampala in 2010, exclusively on health. And there was another one this last year in Abuja. So, you know, our leaders are taking this matter seriously. We have an African platform on health workforce. There is even an AU health strategy, and some of the countries are moving. Things are getting better. And this is part of the global movement. I just want to concentrate on some of the key focus areas that are of interest to you as educators. I do not know how many of you are aware of a movement, Charles Bolling and co., the Global Consensus on Social Accountability in Health Professionals Education. You should be very familiar with that stream of work. And then there is the Lancet Commission on the health professionals for a new century. That work also you should be very familiar with because it's got some recommendations. But Erika, that work, I can assure you, the GWA report, Nigel Crisp and Biens Gawanas, it had it all. They basically elaborated on it. And then, of course, the Sub-Saharan African Medical Schools survey and the WHO new guidelines. I hope you brought some for them. But they're on the website, isn't it? But it's important for us to be familiar with all these documents. So a lot is happening. A lot is happening. And really, education and training is the single most important intervention that the world could make. It is the reason why there is a shortage, because we are not training enough. And if we were training enough, then fine, there are those who say train and flood. Is it train and flood? Flood and, what's the name? Flood and retain. There are some countries which take that route. Just train, they will find their own levels. So this is a very important intervention, the one in which you people are engaged. But then also it is touch and go. If it's not right, then the dangers of getting the wrong type of people is there. If the education system doesn't get their act right, I've said their education institutions are like factories. This, in fact, is not my original. This is Odonga. Those of you who know him, this is him. So a good factory produces a good product, a bad factory, a bad product. And once you have bad factories for which you people are responsible, then we are all in very big trouble. So you are very important. You are the solution to the global health workforce crisis. You are groups like yours. And quite honestly, that is true. Believe me. And this is from the Lancet Commission. And what I want to speak to here is the point which they make that the education system should churn out enlightened change agents, the leadership attributes. And the people whom I remember as a student myself here at Makerere, they were leaders. The head of a department at Makerere was also quite literally at that time the head of the specialty in the whole country. and they used to supervise the rest of the country. Should we be wanting to go back that way? Is it possible to have a way in which we can link the leadership of the university with the service components, the real day-to-day service component of the system? One country, Iran, their health services are run by universities. And they have actually one of the best primary health care systems global. It's not talked about. People, you know, there are those who don't like to talk about Iran and Cuba and so on, but believe me, these two countries have some of the best primary health care systems in the world. So in Iran, health services are run by vice chancellors of universities. And it is one of the best primary health care systems I know. I've visited them. So let's move. What do we need to do? I think these are some of the key things. Let's become open-minded. Things are changing. If we don't change, we are not, if we remain training the way we always wanted to train, the way we were brought up, we are not going to respond to today's needs. So needs-based training basically means each country should define for themselves what their health priorities are and train for them, and train for them in the most flexible way that they can. And I see maybe in 100 years' time, or maybe earlier, this business of doctor, nurse, pharmacist may not be there or may not be so important. Who knows? That is the possibility. So, and of course, for us, Africa is still responding to the rural needs, because in most countries, most people live in rural areas, without neglecting the urban people. And the question of the global, that's going to remain with us. We have to deal with it. But we have a tool, the WHO Code on Health Workforce Migration. If you read it well, it's very comprehensive. It addresses all the challenges faced by both countries with the excess health workers and those with smaller numbers of health workers, those with a large population of young people, and those without. So that is permanent. Back again to leadership. I will speak a little bit more on that in a moment. So FFP is fit for purpose. So if we are going to be relevant, needs-based, we have to train fit for purpose. But fit for purpose does not mean poor quality. It is for the purpose. You train for the purpose. You provide the skills which are needed on a certain location, and those people should be proud to provide those services where they are. And of course, when they were talking about task shifting, it came very strong, very quick. We were telling the drivers of this process that Africa has always been task shifting. The very first missionaries who came here, Dr. Albert Cook and Catherine Cook, one was a doctor, the other was a nurse. One of the first things they did was to train local assistants. And that's how Makerere Medical School eventually started. So we've been doing this all the time, so let's just do it even better. And by the way, in my earlier career as a cardiothoracic surgeon, I went to visit a friend at the Mayo Clinic. And I'd gone there from England, where I was working at that time. And the people who were harvesting grafts for coronary bypass, that's what we as doctors were doing in England. But those were technicians. And there are a lot of this in many developed countries. UK has an anesthetist of this type, or an anesthetic practitioner, and so on. So it is fine. There is nothing wrong with it. Let's grow it. Let's not be shy to train people with skills they need to solve our problems. And it is not only us who are doing it. Everyone is doing it, and it's going to grow, I can assure you. And what are the competencies that we would like these trainees to have? Probably the most important is that they should be prepared to work where they are needed. And to be able to get people who are prepared to do that, we have to select people so that they are linked to their communities. The other day on MEPI, we went to the University Zimbabwe, medical school in Zimbabwe, Harare. And they were interviewing students who were joining medical school for the first time. And they were very excited by it because they wanted to address this. Because some people are sent to medical school by their parents against their will, and those would then be weeded out at that stage. And also to make sure that the selection does not marginalize certain parts of the country or certain communities. And that one, responding to health needs, I've spoken enough about that. I want to speak to bullet number 3, able to deliver quality care with available resources. So the training should be able to produce a graduate who is going to work with the tools which are there in health center force. That is for Uganda. I mean, that's where that's the bottom place where like a doctor is, or a nurse, wherever they are supposed to work. So if you train, particularly with new technology, everything, ultrasound, CT scan, MRI, and then you send these people to where there are no MRIs, there are no CT scans, there are no what, you would be doing them a disservice, and they will not stay there. Somewhere along the way in my career, I went to work in a mission hospital. And the main purpose, together, I was supported by the Association of Surgeons of East Africa, Ngora Hospital, for those of you from Uganda. And the main message there was to see how you can do things as cheaply as possible. And it is so much you can actually do without being encumbered with so much technology. Using your 5 senses: inspection, palpation, percussion, auscultation. All those things, you can make so many diagnoses without needing a lab. When you need a lab, you should take a lab test because it's going to change the way in which you are going to decide about the patient. But also, you can be taught that the longer differential diagnosis you have, the longer list of possible treatments that you can give, the more marks you get in an exam. But then, are you doing the right thing? Perhaps what you should be getting more marks for is the minimum number of investigations that you need to do to move forward with making a diagnosis or deciding course of treatment. So these are issues which I would like you, ladies and gentlemen, to apply your minds to. Because at the end of the day, this is what will matter. I was told by a colleague in Nigeria that their young doctors can't stay in up-country hospitals, rural hospitals, because they don't have the skills to work there. And they are ashamed of their, even the community can tell, say, hey, we've received a new doctor, a new nurse, there are problems. So you take off, and why not? So I would like you to think very seriously about this. Also, the red one there, clinical excellence as a foundation for teaching and research. So if you are not practicing well, how do you teach? Certainly, my generation were very privileged. The things at Mulago were very good, and we had teachers who were role models, and we learned with them. But because of so many things, this is very much challenged. Are we there? Are we actually practicing clinicians when we are teaching? Are we, you know what I mean. So that's a very big challenge. Mentorship. And of course, inculcating the tenets of continuous self-directed learners to students, because they see you, their teacher, also doing the same. So these are the same messages, really. I've made them already, all of them. And these strong linkages with the communities also is important. And this is a challenge for us in Africa. Things are evolving. You know, children who come to medical schools come from certain families, and even the school system detaches them from their roots, and they don't like to live there anymore. I think it's Malawi who actually has a rotation program where they send the students to live with families in those great thatched roundabouts. I don't know whether that's a good thing or a bad thing, but they do that. And if you have, like, the son or daughter of one of you people here who grew up in Kampala going to schools with the running water and running water at home, will they agree to do that? So those are also challenges which we need to discuss. This is about research, evidence. I would like to encourage your institutions to be continuously undertaking studies to demonstrate how you are achieving your goals as a training institution. Do we have evidence which demonstrates that our medical school, nursing school, or pharmacy school is accountable? I don't know whether you have any people from this group, professional colleges. I see them also with a very strong potential for the future. And I would like to encourage you to bring them into your fold. Because just in February, I witnessed the launch of the College of Health Sciences of East Central and Southern Africa in Arusha. So we started with the College of Surgeons, the anesthesiologists joined, the pathologists have joined, another group has joined, and now the room is open for others. And these have, to me, tremendous potential because they can train specialists or non-specialists anywhere. They don't have to be in urban areas or in university teaching hospitals. And that answers to one of the other issues, training where in real life situations. So I would like to encourage you to bring those groups in your fold and to support them. So now, we are now starting to talk about the health system, the broader health system. And health is one of the elements of a national development plan for a country. Most countries have got comprehensive national development plans, Vision 2030, 2040, 20 what. In the past, they were called PRSPs, Poverty Reduction Strategy Papers. And here in Uganda, we called it PEP, Poverty Eradication Action Plan, the first one we made. So health should be part of that, health of the population. And then, of course, the National Health Plan, the National Human Resources Plan. I'll talk later about the CCF, Country Coordination and Facilitation, and planning for long-term, to respond to the long-term visions, but acting for short-term, continuous review through your human resources information systems, and of course, your resource envelope. That's also very important. That's why we go back again to doing what you can do with the resources that you have. And we are moving on. In order to make a good national HRH plan, you need to prioritize what is our disease burden, what are the areas that we should be training for, what facilities do we have, what are our resource envelope, what health workforce is there. So a national health workforce information system is extremely important. And I think they call it, I think there's the African Health Workforce Observatory. They are encouraging countries also to call theirs observatories. But it's basically a health workforce information system. How many are getting into the training schools? How many are qualifying? How many are getting jobs? How many are leaving the country? Each year there should be such a report. Who is where? And for you as the training institutions, I think your role would be to put in place permanent graduate tracking mechanisms so that you know where your graduates have gone, and that's also how you will be implementing your social accountability. So MEPI is doing this for the MEPI schools, but not all people are in MEPI. And partnerships also are very important. In-country partnerships, regional partnerships like this, and global partnerships. That is the future. The world of the future is going to be one where there will be co-development. We learn from each other, the Southerners learning from the Northerners learning from the Southerners, and your institutions should have partnerships across all those categories. This is from one of the GWA studies. Rika, you'll be familiar with this. Did a study on 9 countries, the critical success factors for a successful health workforce planning and scaling up. Political commitment is, of course, by far the most important. We will talk about that again in a moment. Then back to workforce planning and creating the enabling environment with good information systems and getting stakeholders together. So this is where I'm going to talk about the leadership and governance. So this is taken from a study which is called Strong Ministries for Strong Health Systems, a study on, by Archest and New York Academy of Medicine, how to support ministries of health, ministers and ministries of health. So here, this is the environment in which the Minister of Health is operating. So the ministry is there. In the middle, the minister is there and his ministries. There are other government departments, and in our case, we are very much interested in education, in finance, in the public service, also local government, and there are also other private groups. That's the global environment up, and the head of state, who is very important determinant of what happens. Then in the oval here is a very important group of institutions, like universities, like professional associations, like academies, research centers, NGOs, civil society. So you are one of these. So your role is to support your government, your ministry. What you would like to happen in your country, you support your government by informing and inspiring them, but not by naming and shaming them. The research which we were talking about, that evidence, you should package it and find a way in which you will access your Minister of Health as change agents yourself. So this is and by the way, the governments are very important indeed. Very, very important. Very important. These are people who, in most cases, have been elected by the people. In some cases, which is not allowed now, even if they come by force and sit there, they are there. There is nothing much you can do about them. But these people are the ones whom the world has accorded the responsibility to coordinate things on behalf of the global community. So the leadership role of governments is there. It's a given. And our job is to support them to play their role well. We can't ignore them. Many times, I'll tell you this short. I was given latitude to speak for long, but I'm not going to speak for long. One of the MEPI principal investigators, I was speaking sort of like this. I gave a talk in the first meeting. And one of them came to me later, say, oh, why do you want to talk to government? Say, a very senior person, a dean. And if you have a dean who doesn't see why they should talk to government, you should not be in that job. But fortunately, I met another dean in that same group who now says, actually, after the minister, I'm the next most important person in the health sector, which was very encouraging. I am not sure whether he was right, but he said it. So I would like to encourage you folks, governments have roles which the governments can't delegate. And our job is to support them by informing and inspiring them, not fighting them. That's another very, very important message. So this is a health system. There are many ways of presenting a health system, but really, in brief, it's the arrangement which a country has in place to provide health care to their people. That is it. That's the health system in a nutshell. And it has a number of components. So there is personal health care. Some of you are clinicians. You see a patient one by one, one by one, one by one. Some of you are in population health, public health. You do it wholesale. That is David Serwada. He says they are wholesale, better than retail. And health systems research is very important. You need to know where you are going. How do I know I'm doing the right thing? Am I doing the right thing? How do I know I'm doing the right thing? That question needs to be permanently asked all the time. So that's health systems research. Then we have health in all policies. And that's where you come in to advise your government, your minister of health, or any other minister who may have impact on your work. How is my work connected with water ministry, with public service, with finance ministry, with agriculture ministry, etc., etc. So if we have strong professional associations in the countries, they should be articulating these issues, making sure that these health implications of every policy are addressed. And this is the WHO. It's basically these blocks, they call them health system building blocks. But what they really are components of the health system outputs. And you people, as educators, you should be familiar with these things. That big picture message, especially if you are leaders. This is from the GWA Human Resources Action Framework, how to make a national action plan. How to scale up, and the message here is that because of resources issues, each country will develop a basic package of essential health services which they deliver with the resources that they have. They create a health workforce with a skill mix which responds to that, and they distribute those in teams as close to the clients as possible. So that is how you build that up. And then, of course, there are the technical bits, political and money are very key components of the planning. And we will come back to the CCF later. So here, if you want a good and a functional human resources plan for the country, so it needs to be developed through multi-sector participation. And all the key players should be in: the professionals, civil society, the political group, the private sector, other ministries, and so on, to implement an agreed strategic plan. And there should be linkage with this. Basically, I'm repeating this, but the main message here is that these 4 pillars are important for you to get in your country a decent health workforce program as part of the robust health system. And these are more. You need the partnership. I've talked about that before. You need advocacy groups. You may not be, you may have the information, the data, but it's good to team up with like the Health Consumers Association. There may be people about women's this, the children's that, and so on. Those are your allies. When you have your committee, you bring them along to sit there with you, and they will go and shout with banners when the budget is being passed. I think Uganda's, East Africa, they are reading the budget now. We are talking here, they are reading the budget now. So your people would be there, you know. So you need to link up with those. And then again, leadership and management, strong professional associations. When you have a good country coordinating and facilitation mechanism, this is what you get. One comprehensive costed evidence-based HRH plan, responding to your national vision, a financing plan. Capacity building of stakeholders is very, very important. All those people in the Oval, they all need to be able to do their jobs well. They need resources to do that. So capacity building of all the stakeholders, and an M&E plan. That's part of the Health Workforce Information System. And then we have to assure quality. We need strong regulatory bodies. You should be interested in the regulatory bodies in the country, the Nurses and Midwives Council, Medical and Dental Council, the Pharmacy Council. You should be very active there yourselves as teachers of pharmacy or nursing or medicine, because that's where a lot of things will happen to determine even the quality of your own work. And by the way, in many countries, these are also the people who accredit you, isn't it? They have powers to close your school. So you should be very much interested in them, and they are very important indeed. But you can also develop, like your association, you can develop an informal. There are two types of leaders. There are designated leaders, there are informal leaders, formal leaders and informal leaders. If you develop accreditation criteria for good training institutions, and you start making reports, even without anybody's permission, in years to come, they may then say, this group, what do you call yourself? You know, someone will use your data if it's credible. Support supervision, educated demand, that's also very important. The population is, you need to support them. We are part of the population. Something goes wrong, and you can either just shrug your shoulders and go away to find another solution, or you can say, hello, what is happening here? I'm supposed to get this service here. Why is it not there? So that is what keeps other systems working. Something is wrong, it is not tolerated. But in many of our countries, you know, it's none of my business. And then self-assessment, am I doing the right thing? Those are all very key interventions which you should be looking at. And so what for the country? So the message is that countries should prioritize education and training of health workforce as a key entry point for addressing the country's and even the global health workforce challenges. How do you prioritize education? All those things I've talked about will help you to do that. And we should link this with national development plans. And and link with the population health needs. Each country should have a CCF, country coordination and facilitation tool. We should have very vibrant and active health workforce information systems. Plan long-term and short-term. So that I ended the speech like that one time, but this is not the end of this speech. This is the end of this speech. And those of you, many of you are familiar with this, so, but I will never get tired of speaking like this. So, you know, the people like us, we know a lot. Actually, we know quite a lot. You know, but we also live side by side with things which we know are wrong. And the degree of our upset, anger about these things is a very embarrassing silence. So I would think that if people like us, you and me, here in Africa, took our business more seriously, in my other writings I call them techno-professionals. If we used our knowledge more constructively, more aggressively, as change agents, one of the slides talking about being change agents, I think Africa would be a very different place. In my view, some of the things which have gone wrong here, we are accountable for that. We are even responsible for that, for keeping quiet when we know that we should not keep quiet. So we need to be leaders. Each one of us, one by one, not collectively even. Well, collectively, so much the better. But it is all of us alone. So I'm going to go back from here, and I'll be a better teacher. I will try and do some of these things which Omaswe is talking about. I will mobilize other people to do that, because it is going to be us. There are three groups of this triangle which moves the mountain. There are people like us, there are the communities, and there are the politicians. If we, as the people with the knowledge, we analyze the knowledge, we manage the knowledge, we shared it with the communities and so on with everyone else, I think Africa would be a better place than it is today. And my message to you really is to go from here as change agents. If you are not already, I take it you already are. But there is a lot that people like you and me can do to make Africa a better place. And through just the fact that you formed this group, I'm so happy that you've been able to do that, and that you will use your group to make Africa a better place. Thank you for listening to me. Bye.